Back pain is incredibly common. Most people will experience it at some point. And the good news is the vast majority of back pain is not dangerous. But there are certain red flags that we look out for in clinic that would tell us that your back pain requires proper assessment. So let's go into what those red flags are. If back pain is associated with new numbness or weakness or tingling sensation of one or both of your legs, then we take that very seriously because it can be indicative of nerve compression, a slipped disc, herniation, or inflammation around the spine. A key point here is that weakness is more concerning than pain. So if you are struggling to lift your foot or your knees feel unstable or your legs going to give way, then that is a red flag. And that's not to assume that something sinister is happening. It's just nerve compression is best assessed early. This is one of the most important red flags. If you ever get back pain and you develop new difficulty in controlling your bladder or urine, such as incontinence or retention, or not feeling the urge to pass urine, then this could indicate cauda equina syndrome. And although this is rare, this requires urgent assessment when it happens. If you ever get numbness around the inner thigh or the buttocks or groin, what we call saddle numbness, then that is a red flag because it could indicate a nerve compression lower in the spine. Some people have described this as strange or tingly or less sensitive than normal. If you develop back pain with a fever and chills and you've recently had an infection, especially a urine infection, a blood or skin infection, then this could mean spinal infection. However, spinal infection is extremely rare. But the relevance of this red flag becomes extremely important for those that have diabetes, are immune suppressed, or are on long-term steroids. If you've ever had cancer in the past, particularly breast cancer, lung cancer, prostate, or kidney, then new back pain is not something we will ignore. Unexplained weight loss, night sweats, or generally feeling unwell alongside this new back pain lowers the threshold for doing scans. Again, most of the time, back pain is completely benign, but your medical history tells us when to investigate sooner. You're slightly more at risk of a serious cause of back pain if you have any of the following. But it doesn't mean anything is wrong. It just means that we'll take your symptoms a little bit more seriously. Again, 90% of the time, back pain is mechanical, meaning it's posture, it's a disc, or it is muscular, which means that these things are very uncomfortable, but they are not dangerous. And therefore, the red flags we specifically discussed today is what guides us to act quickly. If you've recognized any of the red flags we discussed today, it's worth getting assessed. Sometimes a really quick examination, a scan or blood test can really quickly give you reassurance. Thank you so much for watching, guys, and I'll see you in the next video.